The Mediterranean diet is a diet inspired by the eating habits of people who live near the Mediterranean Sea. When initially formulated in the 1960s, it drew on the cuisines of Greece, Italy, France, Spain and the Ottoman Empire. In decades since, it has also incorporated other Mediterranean cuisines, such as those in Turkey, the Balkans, Lebanon, Syria, North Africa, and Portugal. The principal aspects of this diet include proportionally high consumption of unprocessed cereals, legumes, olive oil, fruits, and vegetables, and moderate consumption of fish, dairy products, mostly cheese and yogurt, and meat products. Olive oil has been studied as a potential health factor for reducing all-cause mortality and the risk of chronic diseases. The Mediterranean diet is associated with a reduction in all-cause mortality in observational studies. There is evidence that the Mediterranean diet lowers the risk of heart disease and early death. The American Heart Association and American Diabetes Association recommend the Mediterranean diet as a healthy dietary pattern that may reduce the risk of cardiovascular diseases and type 2 diabetes, respectively. The Mediterranean diet may help with weight loss in obese people. The Mediterranean diet is one of 3 healthy diets recommended in the 2015 to 2020 Dietary Guidelines for Americans, along with the DASH diet and vegetarian diet. The Mediterranean and DASH diets are 2 of the main sources for the MIND diet recommendations. The Mediterranean diet is low in saturated fat with high amounts of monounsaturated fat and dietary fiber. One possible factor is the potential health effects of olive oil in the Mediterranean diet. Olive oil contains monounsaturated fats, most notably oleic acid, which is under clinical research for its potential health benefits. The European Food Safety Authority Panel on Dietetic Products, Nutrition and Allergies approved health claims on olive oil, for protection by its polyphenols against oxidation of blood lipids and for the contribution to the maintenance of normal blood LDL cholesterol levels by replacing saturated fats in the diet with oleic acid. A 2014 meta-analysis concluded that an elevated consumption of olive oil is associated with reduced risk of all-cause mortality, cardiovascular events and stroke, while monounsaturated fatty acids of mixed animal and plant origin showed no significant effects. The American Heart Association discussed the Mediterranean diet as a healthy dietary pattern that may reduce the risk of cardiovascular diseases.